Hi, I'm Dr. Lindenberg from Tenafly Pediatrics, and today we're going to be talking about burns. Burns are one of the most common childhood accidents, and they can happen from a number of things, from anything from having hot water spilled on a child or hot coffee, to scalding water in a bathtub, or from a child touching something hot like a stove or a fireplace. And you can even get a burn from overexposure to the sun. Some burns are very minor and can be treated at home, and some burns are more severe and require immediate medical attention. So if your child has been burned, the first thing you want to do is try to determine what kind of burn they have. A minor burn some of the symptoms of that would be some minor swelling or redness to the area, some minor pain, and the skin though should look dry and you shouldn't see any blisters. This is also sometimes referred to as a first-degree burn. Some more serious burns, such as second or third-degree burns, would have different symptoms such as blisters, severe pain, or sometimes leathery looking skin or charring of the skin. If you feel that your child has one of these more serious burns, then you need to get them into medical attention immediately. Sometimes even with a minor burn, you do also need to get them immediate medical attention, and this would be the case if there is a significant amount of skin that is involved with a minor burn, or if a very sensitive area is involved, such as the face or the genital area. Then you should also get them to medical attention right away. Many burns, though, are these more minor burns, which just involve the top layer of skin, and you can treat them at home. So I'm going to go over how best to treat these minor burns at home. The first thing you want to do is remove any clothing from the area that has been burned and run cool water over the burn for 3 to 5 minutes. You could also use a cool compress on the area for 3 to 5 minutes as well. One very important thing, though, is you do not want to apply ice to the burn. This can actually damage the tissue and make it much more difficult for the burn to heal. After you've done this with the cool water, you want to place some cream on the burn, such as aloe vera cream or an antibiotic ointment would be sufficient, and then cover it with a sterile bandage or a Band-Aid would be fine. If your child is having pain from the burn, you do want to give them something for the pain, such as acetaminophen or ibuprofen. And then over the next 24 to 48 hours, you want to just keep a very close eye on the burn. You want to continue washing it gently with soap and water and reapplying the cream and changing the bandage 2 to 3 times a day. With these minor burns, over 3 to 5 days, you really should see the burn heal up very nicely and not leave any type of scar. If at any point during that time you see that the area is looking worse, where the redness or the pain is suddenly worsening, or you do see a blister or any pus coming out of the area, then that's a sign that the burn could be infected and you would need to give us a call. This is the main treatment for burns at home, and most of the time this will take care of the majority of minor burns. Of course, the best thing is for your child to not get burned in the first place, so prevention is the key. There are some simple things you can do around your house to prevent burns from happening in the first place. You do want to keep your water heater set at 120 degrees Fahrenheit or less. If you do use a humidifier in your child's room, you want to use a cool mist humidifier rather than a warm mist humidifier. When you're cooking, you want to try to keep young children away from the stove and have the pot handles turned in towards the stove to prevent any splashes or children grabbing the pots. And older children who might be ironing or curling their hair, you want to make sure that they're supervised until they really understand how to use these appropriate appliances. And lastly, anyone who's out in the sun, any child over 6 months of age, should be wearing large amounts of sunscreen to prevent sunburns.